my first live, which was a couple of weeks ago. This is my second live ever, so please don't please bear with me because I actually don't know what I'm doing. But thank you all for joining. I've been prescribed. Guys, I can't give specific medication advice, even though I'd really love to, but I actually can't hear. Um, but I can explain to you, yeah, what they do. So so clomiphene and sertraline at the same time. Okay, so sertraline is an SSRI, which is a selective serotonin reuptake inhibitor. It works by increasing serotonin by stopping its reuptake. So when serotonin is sort of released to the nerves, it also gets taken up again. So sertraline stops it from being taken up again, so it can kind of float between the nerves and try to boost mood. And clomipramine is a tricyclic antidepressant. So it also boosts serotonin, but in a different way. I'd be a bit cautious, like obviously when you oh, I can hear my voice. Starting it both at the same time, just be a bit, obviously you might find yourself feeling quite anxious, or your sleep might be off for a few days, so don't worry too much about that. But obviously I shouldn't be giving you specific medical advice, but that's how that works. I hope you feel better though. Fear Allah. Yes, we all should. Very true. I think, of course, Allah. I mean, I agree with that. I wouldn't, but I think that science to say that we can't science religion can only be exclusive without science. Like us as human beings,
No,
we were
no,
given the
no.
knowledge by God.
They
So I
both,
don't feel
yeah.
like that's, you know what I mean?
Religion. You know what? If like I'm on my Deen journey for about a year now, and I found that actually mental health and everything is very intertwined in the Deen. People don't
Yes.
actually realize that. Like Allah talks about mental health like in the Quran actually, and we're supposed to look after our mental health.
Yeah.
And science is
100%.
actually, I don't see why
I
they
definitely
separate it. It's actually
and
intertwined in the Deen.
yeah, and I did this video where they were saying about like how actually psychiatry exists. Like it started off in the Islamic Golden Age, actually, and some of the first
Yeah.
psychiatric hospitals and facilities were actually at that time where they used a lot of psychologically
Mm.
informed methods. And I think a lot of the time people believe that psychiatry and psychology began in the West. So I think that they'll be like, oh, it started in the 1800s, but it's like, no, that was like, it
No,
literally
no,
was
no, no.
mentioned
Islam brought
1,400
it
years
to the
ago.
forefront.
So,
Yeah.
so to, yeah. Sorry, I know comments are running fast.
Your
I can't even read
comments
them.
are
I'm so
going
sorry,
really
guys.
fast.
Somali women are hard to be around.
Do you want me to like I don't know because
Moderate.
remember
Oh, do
the
you want to
other
moderate?
day,
Can you moderate while being a guest?
yeah, I can still moderate. So
How do I do that? I'm so sorry, sis. I literally can't remember how to.
like
Assalamu
what do
alaikum,
you
Satin.
remember you were going to ask questions? Like was it like what specifically do you need to like
Oh,
do on the
guys.
live?
Oh no, guys, I'm just chatting today. So I think it's just literally saying hi.
Oh.
You guys are welcome to ask any questions about mental health or psychiatry. I am trying to remember how I can add you. I did the last time, didn't I? Sorry, guys, I'm
Like
just figuring this out. How do I add a
you just
moderator?
click on the person's name and then add mod. So click
Oh,
on the person's
oh,
name and
but now that
then
you're a guest, can you make a comment, Hasna,
me.
so I can click on your name? Yeah.
I'm
Or do you want to
already
be
a
a moderator?
moderator.
Are you a
Wait.
moderator?
Yeah, yeah, you made me moderator last time. Wait, let me just
So
put
does that mean you
hey.
become a moderator this time?
No, no, a moderator, once you choose someone to be a moderator, they're your moderator until you remove them.
Oh wow.
So that means anytime you go live, like I'll get notified that you're live, and then I'll also be able to moderate for you.
That's great. Okay, wonderful. Well, thank you. I appreciate that.
But then I'm trying to think. I can't remember last time you were asking questions. I was like, oh, it's easier if I just rise and tell you, but
Oh
you just
yeah.
want,
No, don't worry
yeah,
about it. I think we can just do it based on what people are writing. There are like almost
yeah,
50
yeah,
people here, guys. Hi,
exactly.
welcome.
Do you remember
Thank
last
you
time?
guys
I
for
think we
joining.
had like 300 people. I was like, it was
And apparently
crazy.
I didn't know because obviously that was my first live. I don't know what the normal number is. So I'm
Yeah,
like,
that
I
is a
spoke to
high
someone, they were like,
number.
that's a lot of people.
Yeah, that's a lot of people.
Is it? Oh,
Yeah.
alhamdulillah. That's really great. Oh,
And
thank you so much.
I think partially, like if you notice that my account is pretty private, I don't, but because you're visual, so you know what I'm talking about. A lot of people are like, oh, here's someone.
Yes,
I'm
fair,
like, no,
fair.
she's not here for marriage yet. Like, leave her alone.
Oh, that's so funny. Yeah, there was a lot that last time, wasn't there?
Yeah,
Sigmund Freud, what does he say? So,
Sigmund Freud.
Sigmund Freud was a psychologist in the 1800s. I think he developed a lot of psychological, like things like he spoke about the subconscious, the conscious,
Oh,
like,
there's a good
Mhm.
question. Do you think there's a link between psychosis and autism? Oh,
Absolutely. Oh, absolutely. Sorry, guys, I'm going to take this off because it's really irritating me. I'm overstimulated with it. With cortisol, did you say?
no, autism.
Autism.
Because someone's written that in the comments,
Unfortunately, there's an
psychosis and
increased risk.
autism.
There's an increased risk of mental health difficulties, like with most mental health difficulties with individuals who are neurodiverse, unfortunately.
Mm,
So I wouldn't say necessarily there is a link, but there's an increased risk with neurodiversity, learning disabilities. We find that they are, and it probably is just a lot of the stress that can be associated with it. It's such a
yeah.
people are chatting in the thingy. So what do you do, Hasna? Tell me
Me,
about you.
I'm pretty private, so I'll message you. I don't mind telling
Oh,
you
sorry.
privately,
Of
but
course. Yeah,
I
no, of
won't do
course. I'm
it.
so sorry.
Like I get people asking me, oh, like I don't know. Some people think I'm Somali as well now. I think because I was on your live, and I was like, I'm not Somali, but
That's
it's
hilarious. You know
fine.
what's crazy is I thought you
Have
were. I'm
love
so
for my
sorry. I don't know why
Somalian
I just
family.
assumed that.
No, no,
Because you're on my line.
yeah, I'm Bangladeshi, so I'm not actually Somali.
Oh,
But
amazing. But it's
like
an
people are
elite
saying, "Oh, are you
combination, isn't it?
Somali?" And I was like, "Yeah, if you want to think of me as Somali, go for it. I
I
don't
see
mind."
so many Bengalis and Somalis who kind of look interchangeable, to be honest with you.
Oh no, no, visually, yeah, I look more Pakistani, I guess.
Yeah.
Yeah, no, I'm not,
I
and this comment is why I stay private on TikTok. It's
Fair,
like, yeah,
fair.
you get
So
it,
I
and
am always right. Asked how do I switch off my empathy before sessions? I don't. I don't. I think like a lot of people assume
never,
that in order to do
yeah,
medicine and in order to be a psychiatrist, like we have to not be empathetic. But actually, I think it's beneficial. I think it's helpful to be empathetic and caring towards your patients.
yeah,
And I think people have always said that it's a negative, but I actually think it's a positive, and I think I've helped a lot of people because I actually care. Um,
yeah. Never reduce your empathy, sis. But as long as you,
Absolutely.
but I think you're very much like me, as in you can keep a gap between your emotions and the other person's. But
I
yeah,
can try. I think we're
yeah.
all human, aren't we? There's certain stories that are going to touch us a lot more than others. You know what I mean? Um, oh, I that you're
Um,
getting questions as well.
no, do you know what? Yeah, like my family are very open to marriage, like, but it's not that. It's I'm not on TikTok looking for a husband. So let me just say that. There you go.
Fair,
So
fair enough.
I hope the comment section can, like, but that's what you were getting the other day, and I was like, imagine I don't have my picture up here, and people are still like weird.
No, I mean I get it. What was the question
Can
before?
you
Sorry,
help and only Somali speak? Oh, I think maybe the person wants, um,
can help only
maybe they want to
speaking.
rise and speak to you in Somali.
Yeah, I mean you can if you stop. What question? I don't know. Sorry, guys. I'm trying to keep up with what you guys are writing.
I'm not dodging
Ocean,
any
I'm so sorry to hear
questions.
that you're mentally
Yeah.
drained. I think that's such a normal experience that a lot of people are going through.
Oh, someone's
Um,
asked about a
Fluoxetine
fluoxetine and
or
bulimia.
bulimia. I'll be honest with you, a
Ooh,
lot of can you with bulimia, does it help with it? I think it can help with some intrusive thoughts, but to completely stop the behaviors, I think a lot of time with eating disorders, the mainstay is therapy. But that would obviously completely um, depend on the case. Is that something that you're taking? Nafisa, how can you develop better emotional intelligence? Do you have any tips on developing emotional? I that's tricky, isn't it? Because a lot of people are just like, oh, you either have emotional intelligence or you don't. But I think it's definitely something you should actively work on. How do you work on it? I'm such an advocate for therapy, but I'm going to try not to like obviously push people towards therapy. So
when you
I
say
think maybe there's a
therapy,
lot.
which therapy?
There's so many different types, and I think working
Mm,
with a therapist to see what works for you, because some people find therapies like CBT really helpful, and that just works on your thoughts and your behaviors, versus psychodynamic, which works on your unconscious beliefs and your childhood. So
yes.
everybody needs, I think everybody's might require different types of therapy, but I think also reading and learning about emotions, understanding your own emotions probably
Yeah,
first before would probably
100%.
really help. Hi, Hassan. Welcome. Guys, I'm not going to answer any personal questions. Apologies. So it's
Walaikum
going to seem like I'm
assalam.
airing you, but I'm not going to be answering them. Not used to feeling before, and it's training me. I don't need to.
I love
This
your
is.
energy and the way that you handle. It's
Oh,
like
thank you, Hassan. You're
I'm
very
just,
sweet.
I'm just very direct. I'm like, nope, not interested. Bye.
I know, I know. Do you know what? Do you know what? Like initially, I think I'm very, very transparent person in general, but I've also started to realize this is the internet, you know. So I'm like,
Yes, it
actually,
is
I'd rather
exactly.
not
It's
say any
easier just
personal
to
stuff.
air.
Ocean, if you're struggling, I really, really, I know it's difficult and there's a lot of stigma about getting help, but speaking to your doctor and maybe trying to get some support, speaking to family, friends, maybe looking at therapy, maybe, whatever you think might potentially help you. Maybe you might need a break. I think a lot of people are burnt out and they think it's depression. Oh, thank you
Mm.
so much, Downtown. That's very kind of
Ah,
you.
let's see.
Um, yeah, so there is, but the person needs to probably know about CBT specifically to psychosis. But yes, there is a role for therapy in psychosis, but you would obviously need a psychologist who understands psychosis. Thank you guys for joining. Thank you for the likes. I really appreciate it. Oh, thank you for the follow.
Oh,
Sorry, guys. As you
I
know,
was having
as
a
so Hasna's
conversation with a
joined.
family member.
Hasna was my moderator in my last
Yeah,
live, and she's very kindly giving me support here. Um, I don't, you
yeah.
know what? I don't think emotional intelligence is a born trait, truthfully, but I think it also
Mm.
depends on your parents. I think how you were raised, not because not everyone is raised by their parents, but your primary caregiver when you were growing up, how emotionally intelligent they were, will often tend to inform your baseline emotional intelligence. But after that, it probably is an active process to you learning yourself. Um,
Sis, I've got a
oh,
question for
absolutely.
you.
Yeah.
So like, say if people are unaware, like in South Asian communities and like our minority communities, like mental health or like psychosis is not really understood. So if you were to sort of, how would you want, how would you approach that subject if a family is not even aware of psychosis as a thing and they just go to like, oh, it must be black magic XYZ? Like, how would you approach that situation?
I think first of all you approach it from understanding their perspective. You know what I mean? First of all, understanding what's their level of knowledge about it. Do they know anything about mental health? So that's the first thing. You want to understand what they know. The second thing is you never want to discount their religious beliefs. I think a lot of the problem is that you'll have a lot of people being like, no, that doesn't exist. And then people who are obviously religious will not trust that health professional or that person, to be like, how can you say that this cannot be jinn or something when that's something that our religion believes? So the first thing I'd say is obviously validate that they obviously could be that element and get them the support from a religious perspective. And then from there saying, well, you've done all these things and you're still
Mm.
struggling. So I really do think you need to, like, I think we need to be normalizing that this could be something that we call psychosis. A lot of people struggle from it, okay, I'm gonna block you because that's actually extremely rude, Liba. How do I do that now?
Oh, click on the
Extremely rude.
person and then there's block or mute. There you
Yeah,
go.
yeah, I've done that. I'm so sorry that people are using that kind of language in the chat.
Yeah, it's weird.
Um, so
Yeah, so you were saying about psychosis, that explain.
yeah,
So how
then
would
after
you
that,
simplify
I think just
psychosis to people that are,
so I would just explain that you have to think about it. It's very similar to illness in the body. You know,
mm,
it's effectively the same way that someone might end up getting diabetes, might end up getting hypertension. Psychosis is just unfortunately an illness of the mind, and our mind and our body is so strongly connected. Psychosis is just what happens when you lose touch with reality, and it might seem very real to you as a person, but unfortunately that is your mind playing tricks on you. And I think what happens is a lot of the time people say, no, you're just making it up, your brain is lying to you, blah blah blah. Like for them it's so real to them. So you have to say, like, if this is, I know this feels very real to you, but it isn't. So there is medication, there is therapy, there is thing you can have a better quality of life. So I think just speaking from positivity, saying that you're right now, you can see that you're struggling or this person's struggling. Let's try to get help in order to make things better. That's just the aim. I think when you come from it whereby you're sick, you're unwell, you're this, people feel very defensive.
yeah. Ocean Six, please type your question.
No, she didn't give me space to answer it. God
Yeah,
bless you.
the comments are
Um,
going so fast. Like,
Yeah, no, thank you guys so much for
Ocean
joining. I
Six, what was
appreciate
your
it.
question?
Especially when they're a danger to themselves and others.
Yeah.
Absolutely. And I think that's the main thing that's often where they get to the point. You'll see a lot of the time from our cultures, like because we obviously have such similar cultures, people will not get help until they get to that point. Until you're getting to the point where this person is now potentially a danger to the family or the neighbors or people in the public, or they're very vulnerable. Because I think a lot of the time people with psychosis, people think that, oh, they're a danger, but actually they're extremely vulnerable. Imagine not understanding reality and how people can just take advantage of
Yes.
you in those circumstances and things like that. So I think we really need to try to get them earlier, because that is, if you get treatment a lot earlier, you're likely to have better prognosis and a better quality of life. What do you need? What do you need my help with? I'm so sorry, I can't actually give medical advice, and I don't do consultations. Like, my page is purely education. For everybody who's joining, thank you so much for joining. My name is naFisa. I'm a psychiatrist. I'm a psychiatry resident, final year. And I'm just speaking about everything medicine, mental health, any questions you might have. Hasna has joined me. She's my live buddy today.
I don't know, sis. Do you want me to drop or do you want me to stay here? Like I can stay here
No,
and
I
stay
mean, honestly,
muted.
whatever you feel comfortable, you're more than welcome to be in the chat as well. Like, don't feel pressured. Do you know what I mean?
No, no, I'm fine. Like I'll just mute and then that way I'll keep an eye on like the chat because it's going crazy.
Okay.
So you
I know.
carry
Oh, thank
on.
you so
Go
much.
on.
Thank you. Thank you. I love appreciation. That's very kind of you. Thank you. Exactly. I think, sorry, Ocean, to hear that, about your family. I think a lot of the time, a lot of our mental health difficulties actually are a result of the environment that we're in. And unfortunately, it just means that we might potentially, need to have potential changes or boundaries. Um, I'm so sorry to hear about your anxiety, depression. I can't give actual any particular medical advice or treatment. It's mainly for education. Um, Absolutely, I do believe.